Hey, I'm Kara. I'm an ultrasound tech, and let's talk today about internal scans and pregnancy. So, for those of you that don't know, an internal ultrasound is exactly what it sounds like. It's a camera that actually goes inside the vagina just to take a better look at things. Now, in your first trimester of pregnancy, if we are doing an internal scan for the pregnancy, it is usually to be able to see baby better, or there are some issues such as a subchorionic hemorrhage that we would like to see better. But for the most part, it is to see baby better, mostly because it is too small. In the second and third trimester, however, it is not to see baby better, but it is more for your cervix as well as for your placenta. In the second and third trimester, baby is big enough for us to be able to see everything from up above without the internal scan. But when we are dealing with things such as a shortened cervix, or if your placenta is overlying the cervix or close to it, like a placenta previa, that is when we are needing to do an internal scan to get a better look at everything. Now, this question here is asking about the safety of ultrasound when you are 28 weeks, so in your third trimester. Now, ultrasound is going to be used internally safely for everything in pregnancy except for two scenarios that I can think of, and that would be premature rupture of membranes or when you are bleeding from placenta previa. Now, with premature rupture of membranes, this is where you are actually leaking fluid, so you are leaking amniotic fluid. We are not going to be doing an internal ultrasound in these types of cases because of the fact that internal ultrasounds can introduce bacteria and infection to that area. So, if you think about it, if you are leaking amniotic fluid, that does mean that your cervix is slightly open. And that means anything that we insert inside, as in the internal ultrasound camera, does have an increased risk then to introduce bacteria, and then that means mom and baby are at a higher risk for infection. So therefore, we are not going to be doing an internal ultrasound when there is premature rupture of membranes. And the second scenario is going to be if there is bleeding from placenta previa. And this is not to be confused with just placenta previa in general, because we actually do internal ultrasounds all the time when we suspect there is placenta previa. And how we see this is from up above, so just with the regular transabdominal ultrasound, if the placenta is low lying or completely covering the cervix, then we do need to do an internal scan just to see exactly how far away from the cervix the placenta is, or if it is covering it completely. So up here you can see that this picture is actually depicting just a normal placental distance from the cervix. So you can see the placenta edge is over there, and then the cervix is over here. And the distance between here to here should be at least 2 centimeters. Versus this picture over here, you can see that the placenta is actually covering where the cervix is over here. And in these cases where the cervix is actually completely covered by the placenta, or if it's very low lying, then the patient will not be able to deliver baby vaginally, and a C-section will then be required. Now, an internal ultrasound, as I said, is great for taking a better look at placenta previa, but we do not do it if there is already bleeding from placenta previa. This is because anything that is inserted vaginally when the patient is already having bleeding from placenta previa can actually increase bleeding and sometimes cause major sudden bleeding. So you can imagine this can be catastrophic for the patient as well as for baby if we are doing an internal scan and then all of a sudden that is the cause of having major bleeding. So that's why we do not do an internal scan if there's already bleeding from a placenta previa. But those are just the two scenarios that I can think of in which we would not do an internal scan in pregnancy. So basically, those are the only two scenarios where the internal scan is contraindicated. But otherwise, it is perfectly safe and very normal for us to have to do a internal scan, as there are many reasons in pregnancy why we might have to resort to an internal scan to see things a little bit better.